I've heard it said quite often, well, pull yourself together. Well, if your heart is malfunctioning, nobody says, what have you got to have a heart attack over? But if you get depression, people will say, what have you got to be depressed about? And it wasn't actually anything current, but it began from the age of 14 when my mother died. It was just too much stress all in one go with everything else that had been undealt with from the past. And that was the first time I'd gone to a doctor and asked for help. I knew that I was pretty ill at that point. I studied counselling myself, became a counsellor, helped myself, and was then able to help others. So I asked for a placement in Mind because I didn't feel very safe going anywhere else, really, because I knew that I wasn't ready to return to work full time. This was round about the time of all those publicised suicides in Bridgend. And there was a huge need for something to be put into place because all these young people taking their own lives was absolutely horrific. With the mental health first aid, we teach how to recognise when somebody is at risk of going downhill. Because if people are helped right in the initial stages, it's the same with physical first aid. If somebody breaks an arm or a leg and they get help soon, then they can get well quickly. If a broken leg is left untreated for 2 years and then it's treated, well, there are going to be complications. As you would have physical first aiders in a lot of workplaces, youth clubs, schools, you name it, there are physical first aiders in most places. And what we would like to see is for mental health first aiders to also be in all of these places. We've trained over 4,000 people in mental health first aid. And there's been an overwhelming positive response from people where they've said every business, every organisation should have this training in, because where there are people, there's mental distress.